Welcome back. I'm Lynda Kinkade. Well, in an unprecedented move, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. has dismissed all 17 members of an expert panel that advises the CDC on vaccines. The group is, in his words, plagued with conflicts of interest. Kennedy says they will all be replaced with new advisors. One of those dismissed experts says, quote, "I've never seen anything this damaging to public health in my lifetime." Well, joining us now is the Dean of Brown University's School of Public Health and former White House COVID-19 response coordinator, Dr. Ashish. Thanks so much for joining us.
Thank you so much for having me back.
So, as we've heard from Robert F. Kennedy Jr., he says this was needed to restore trust. We heard from Dr. Tan, who's the president of the Infectious Diseases Society of America, who said unilaterally removing an entire panel of experts is reckless, short-sighted, and severely harmful. Dr. Jha, what's your reaction?
Yeah, so I think, first of all, we should call this what it is. I mean, Secretary Kennedy is basically using a lot of nonsense, lies, if you want to call it that, to dismiss a group of experts who shape what vaccines, if any, are going to be available to the American people. These people have been thoroughly vetted. They are experts in the field. So this is very, very concerning move, and it worries me a lot about where he is going with the entire vaccine strategy for the country.
Yeah, exactly. It was interesting when you think back on his confirmation hearing. We heard from doctors, including one from Louisiana, who assured the committee that he wouldn't do anything to the CDC, that he would actually maintain the Prevention Advisory Committee on immunization practices. He's certainly broken that promise. What does it mean? Like, what's the risk, given that we've currently got a measles outbreak and we're already seeing vaccination rates in children decline?
Yeah. So I think we have to look at this move in the broader context of what Kennedy's been doing, right? So we have the worst measles outbreak we've had in 25 years, and he has not come out and been as clear as he needs to be about people needing to get vaccinated. He has raised the issue of vaccines and autism. This is settled science, and he's raising kind of debunked issues already. And between all of that and now this move, I think what all of us are worried about is, what is the future of vaccines? Are we going to have polio and measles vaccines available to kids in the United States? Are we going to have flu vaccines available to the elderly in the United States? At this point, all of that is in question. And I think the answer is we just don't know based on the way he is behaving.
Yeah, and there's also concerns around insurance coverage. If these vaccines aren't recommended by the CDC or government, whether insurance companies will even cover them for children.
Well, this is actually the critical issue, because he's saying, look, I'm not taking away anybody's choice, but he knows, because he obviously understands, in America, if the CDC isn't recommending it, private insurance companies won't cover it. Also, if the CDC stops recommending it, half the kids in America get their vaccines through something called the Vaccines for Children program. That program won't cover it. So if he decides with his experts that polio vaccines are no longer recommended, kids in America will not get vaccinated against polio. I mean, this is a very dangerous backward turn that we have got to push back against.
Yeah, and on top of gutting the vaccine advisory, the Trump administration is cutting public health research. We've seen hundreds of scientists sign a scathing letter criticizing those cuts. And we heard from Jeremy Berg, who ran the National Institute of General Medicine, who said horror doesn't even come close. It's tremendously damaging to the United States' ability to do research, to the US government, our competitive position in the world. Have you ever seen cuts this deep?
No, look, we've had a 50-year bipartisan agreement in this country that investing in science in partnership with research universities and academic medical centers is good for the American people, not just good for our economy, but we create cures and treatments that make a big difference. That's what the administration is turning its back on. And that's what the scientists at the NIH were speaking up against, because this is unprecedented. We use that word very lightly, unprecedented. This is truly a remarkable degree of self-inflicted harm to the American people. And those scientists are speaking out, saying we should not be doing this at this moment.
So kind of what's the steps to fight back against some of these cuts that we're seeing right across the board?
I think the biggest organization or big group of people who need to step up here is Congress. Congress actually allocates these funds. NIH has had deep bipartisan support because, of course, diseases attack people in blue states and red states and every state of America. And Congress understands that for our competitive posture, as well as for the health of the American people, NIH is a fantastic investment. So Congress needs to step up at this moment and say to the administration, you cannot unilaterally make these cuts. We have got to get back to studying critical diseases, chronic diseases, diabetes, cancer in kids, and cutting funding for those programs is bad for the American people.
Dr. Ashish Jha, always great to have you on the program. Thanks so much for your time.
Thank you for having me.